Thousands of students suffer with depression. According to the ACHA, 30% are so depressed it makes daily life hard to cope with.
Like I would get to points where I physically could not get out of the bed. Like my mom had to like physically drag me.
Positive keepsakes cover her room, but life wasn't always joyful.
It was a little abusive, and the divorce. My mom and dad got divorced when I was younger, and just a lot of stuff.
Years of pain just doesn't go away. She's one of many who struggle to find help. The Mary Walker Health Center has seen an increase in patients. Counselor Kyle Dizentar doesn't know how long students can wait.
Well, if there aren't enough mental health professionals, I think it leaves a lot of people with nowhere to turn. A lot of times people need at least someone to check in with or talk to, especially in major transition points like coming to college, for instance.
A lack of services makes it harder to cope with depression.
I was scared to leave my house, just for no reason. I just didn't want to interact with anybody at all. I just wanted to hide in my room.
Dizentar says depression is no easy burden.
The main symptoms that come up with depression, as I mentioned, were lack of motivation, finding it hard to do things that were once easy.
Zellopar, an antidepressant, helps some deal with the constant pain and suffering.
I've probably been taking medication for like 7 or 8 years, but they switch it up a lot. I've been on this medicine for a year or so, but at the first it was heavy. I'm starting to take less and less. I think they're trying to wean me off it.
She takes these pills 1 to 3 times a day as it helps lift the stress.
And I don't like the feeling of dependency, but it's where this, like, I'm supposed to feel like that. Like it's not adding anything. It's just putting me where I'm supposed to be, you know? And but when I miss a day or so, especially, I would seclude myself and I'd start feeling heavy again.
Slowly, the pills work to lower the burden.
I think sometimes it makes the depression feel like less of a weight. Because sometimes depression can feel very heavy to someone.
A heaviness felt by many. Dizentar says there will be a turnaround.
You know, more people should take advantage of them, and in that case, we need more providers of mental health services. So I'm hopeful that it is continuing to grow.
While Dizentar is hopeful, for others the time just keeps ticking. For WTOP 10 News, I'm Tatiana Bellamy.